The COVID-19 pandemic started impacting the United States in March of 2020. For the most part, with the exception of an occasional outbreak and pandemic-related news, the country has moved on but hasn't forgotten. This group of people includes facility managers like Steve Smith, the Director of Facilities for Clements University Hospital as part of the UT Southwest Medical Complex in Dallas. Steve discusses how his hospital got through the pandemic's early stages and also learned to adjust to the conditions.
COVID could be a story of itself, and that's one of those cases where just you've kind of felt like you were flying by the seat of your pants constantly. We are in academic research, so we jumped right in the middle of COVID. We have a whole bunch of infection prevention folks who just this was what their whole careers were built around a massive infectious disease that is a global pandemic. Those just don't happen. We as a hospital, it was kind of surreal on the different every day. It seemed like different rumors, different expectations, different PPE. Yeah, how long does COVID last? I hear it lasts, a certain amount on wood, a certain amount on metal. How infectious is it? Is it a touch disease? Is it an airborne disease? We didn't know. We just knew that people were starting to get sick and they were coming into the hospital at a rapid rate. When the decisions were made, though, to basically put everybody remote, and I remember it was March 19th here in Texas on a Monday, and our local judge said, essential people only, everybody else, you got to work from home. And we as a hospital were essential. I came to work. I drove into work. I normally ride a train. I drove into work. It was the best train. It was the best trip I've ever had. There wasn't a car in a damn road. But you're walking into a facility. We stopped surgery, and so when you stop surgery in a hospital, you don't need that staff anymore. I didn't need a lot of my administrative staff. They're all gone. Only thing you had was that clinical folks taking care of patients and our staffs. And there was a lot of folks who just tried to do it remotely. And it was hard. It was a transition. We did some unique stuff with the HVAC that it was never designed to do. We didn't know, but we want negative environment is what we wanted. We tried different PPEs. We tried different masks, and we tried cleaning masks because you couldn't buy them enough because everybody was buying masks. It was just such a unknown for week after week after week. You couldn't even go see your boss, your coworker, anybody. You're trying to keep the 6-foot separation. It was a really interesting. Now, Texas was a little different, I think, than other places because Texas didn't embrace the COVID and some of the draconian methods like maybe a California or New York or some of the others did. A lot of the, not to get political, but a lot of more of those conservative red states didn't do them nearly as long as maybe the other states did. I've done some filtration. I can't tell you how many presentations I did on what HEPA filter is and how HEPA filter will, in conjunction with our infection prevention, stop COVID, but other filters won't. I had to explain why we have different ways and everything at HEPA filter. Well, wait a second now. We designed the building with pandemic in mind. And we were in the middle of a construction expansion during COVID. So I got a construction trailer sitting out here trying to finish part of a tower. And they're like, hey, can we work? What's our precautions? We're not working in masks in this thing. Can we go in the hospital? Are we going to get infected if we ride the elevators? I mean, it was just something. It was interesting. I think the one thing came out of COVID was being able to work remotely. We still have folks who work remotely. I think Teams meeting. I think this meeting probably may not have happened in this format pre-COVID. I think the use of the virtual technologies massively is improved. We still have internal meetings where we're all in offices around here. We do them remotely as opposed to walking the conference room like we used to. We just still do. I don't know. I think the response, it would have been interesting if we had said, no, we're just going to operate daily and let it go. But when so many people were passing away on a daily basis, and we converted almost 6 floors worth in COVID treatment. And the stories some of these nurses would tell about, guys in their 20s and 30s with not really a lot of health issues, but not going to make it.
Even though the pandemic is in many cases an afterthought, many of the practices that were developed during that time, such as increased efforts about infection prevention and hand washing, are still deployed today by facility managers at institutional and commercial facilities. Smith discusses some of the practices that his hospital and staff have adopted from the pandemic and still use today.
But people are very much more aware about infection prevention. They wash their hands more. There's still, I think, naturally social distancing that's occurring. I think people, when they're sick, people will say, please go home. Don't try to tough it out here. Go home. I think we build in mind, with COVID in mind now, with, okay, what kind of materials are we using? How easy is it to clean? We found out there's a lot of products that we put in that they're not easy to clean. And so our EVS staff is now looking, when we build new stuff, hey, make it easier to clean so that we can get in, turn rooms quicker. Maybe it isn't as pretty, but it's, you got to give a little to take a little. And so I think infection prevention was a huge one that has changed a lot. The remote work, obviously, we actually built what we call an HCID. We built a suite with our expansion. We built it because we were on the forefront of Ebola. If you remember, Ebola happened in Dallas at a sister hospital here. Well, the state of Texas, determined, since Ebola came to Texas, that we would build a response here. And so in our expansion, we built a HCID, highly contagious infectious disease unit, to do that. And that's some of the things that I think we employed during COVID, was that unit and how we do that. You also learned, I think, teamwork came out of COVID. We worked with infection prevention, safety, floor nurses. We were all coming together and going, okay, we're having a surge again. Delta's over, now Omicron's coming, and you're seeing that surge. Where can we go next? Where do we have the right nurses in place? Do we have the right facilities in place? Do we have the right training, PPE, whatever it is? I think teamwork really came through, and I think we kept a lot of that. I think COVID, though, is like anything else that's unexpected, that those black swans that are out there, just kind of just take it as it comes. And then in retrospect, there's a lot of things we did that were stupid. There really were. COVID, I mean, across the country, across the state, locally, at our hospital, there's just some things that I shake my head now. We were trying to clean cloth mask. I'm like, what were we? Oh yeah, we were gonna clean cloth mask, but you weren't getting your own old mask back. You were gonna get somebody else's mask back. I'm like, that ain't ever gonna work. The big face shields, that was a waste. We wasted a lot of money. We wasted a lot of money with plexiglass here. Plexiglass tables. No, it was crazy.
For a profile of Steve and his career at Clements, see the August cover story of Building Operating Management.